Hello, and welcome to our second episode of Your Health Matters with Marshfield Clinic. I have a very great episode for you today. My name is Laura Kibbel, and I'll be your host, talking today with Dr. Moses, one of our leading dermatologists here at Marshfield Clinic. Hello, Dr. Moses. Thank you so much for being with us today.
Thank you for having me. I'm so excited.
I know. I'm very excited. We have so much to talk about.
We do.
But we only have a short half an hour, so there's a lot to get in a very time-crunched situation here. So before we get into a lot of great information that people of all ages are going to want to hear, I'd like to learn a little bit more about you. So if you could tell me where you grew up, where you went to college, medical school, I'd love to hear more about you.
Yeah. So I am a native Wisconsinite. I was born and raised in the southwest corner of the state, the beautiful driftless area of Wisconsin. My hometown is Dodgeville.
Okay.
If you haven't heard of it, it's the headquarters of Land's End.
Oh, wonderful. Okay.
That's kind of what we're known for. We also have a state park, which is lovely. I went then just a hop, skip, and a jump away to UW-Madison for my undergraduate experience. Loved it there. Decided to stay on for medical school at the University of Wisconsin School of Medicine and Public Health. And in that time, I loved everything. And decided that I was going to be a dermatologist eventually.
Sure.
Do we want to go into how that developed?
Yeah, we sure can. So tell me, yes.
Okay, so in medical school, I loved everything. I know I heard Dr. Hordman say the same thing, that a lot of us are indecisive in medical school, as we should be, because we should keep all of our options open.
Absolutely.
But I ultimately decided to go into internal medicine first.
Okay.
And I did my residency at Duke University in North Carolina.
Okay.
Loved it there.
Okay.
But sort of didn't find that niche or that passion within internal medicine. And I rotated in a dermatology rotation as an internal medicine resident, and I loved it.
Okay.
I went home and I wanted to learn about the patients I was seeing. I was like excited to wake up in the morning and go into clinic. And so it was during that time that I actually decided to apply to dermatology residency. So that was a 3-year stint in Durham, North Carolina at Duke University, and I completed my internal medicine residency before I then traveled to Sanford University in California, where I completed my 3 years of dermatology training.
Wow. Wow. So what brought you back to Wisconsin then?
Well, because it's the best state.
Well, of course.
The beer, the cheese.
Yes.
No, we had 2 kids in residency, and it was a struggle to raise children in kind of the hustle and bustle of the Bay Area, the San Francisco Bay Area. So we decided to come back home to be closer to family. And I had never visited Marshfield actually before we interviewed here.
Okay.
And I fell in love.
Yes.
I love the mission. I'm from a rural community.
Yes.
And I love that we have a dermatology residency program.
Sure.
One of my big passions in dermatology is actually teaching.
Yeah.
And I wanted to be able to teach, and I felt like this was a good fit for my family, my interests, and I have loved being here so far.
Well, we are so very thankful to have you.
Yeah.
So some people at home might be wondering, what the heck is a dermatologist? So can you tell me a little bit about what a dermatologist is and what you treat?
Yeah, so a dermatologist is a skin doctor.
Okay.
So we don't just treat the skin, we also treat hair, nails, and then diseases of the mucous membrane, so like inside your mouth, eyes, that sort of stuff. And we treat all ages. That's what I love about dermatology, is that I treat babies in the NICU, so like brand new premature babies, all the way up until elderly patients.
Wow.
My oldest patient to date here at the Marshfield Clinic is 104 years old.
Oh, wow.
So we really get to see patients of all ages and walks of life, which has been a really excellent part of my job.
Yes. So that kind of, makes me think a little bit. You're saying, beginning of life to towards end of life, and there's so much to talk about in there. Let's break it up a little bit into sections of ages. So tell me what you would see a baby through maybe toddler years for. What would a mom bring their baby in for to see you?
I'd say the most common things that I see babies for is eczema, which is kind of a dry skin rash that we see very commonly happen in infancy and in childhood years. So that would be the most common thing that we're seeing in babies. But we see a lot of birthmarks too. So like mole birthmarks or vascular birthmarks they're more common than you think that they are, but they're kind of more red patches in the skin.
Sure.
We see a lot of those in dermatology because we have treatments for them actually. Other things that we see in that age range can be sometimes molluscum, like viral bumps that can happen, or rashes that can occur after getting a cold from a daycare. But I would say the most common thing that we see in babies would be eczema.
Okay. So let's jump a little bit now into like the preteen teenage years, which is super simple when it comes to skincare at that age.
Exactly.
I have 3 daughters, and I think the what the UV rate is for the day or whatever is common discussion in my household. So, what do you see that age group for, and what is it important for them to know?
There has been just like this influx of preteens
Yes.
and teens coming to see me with oodles and oodles of questions on skincare, and I love it.
Yeah.
Because I'm excited that they're engaged with their skin. It's great. The UV discussions worry me a little bit because typically what they're looking for is that prime time tanning, which we don't want preteens or teenagers to be doing at all.
Yes.
But typically when I see a preteen or a teenager in my clinic, I would say the number one reason would be acne.
Okay.
So a lot of acne concerns as preteens hit adolescence and they get through puberty. That's where we start to see a lot of acne occurring because those hormones are kind of playing a role on our hair follicles and our sebaceous glands, and they can have an uptick in acne. So I see a lot of acne. I've been seeing a lot of mole checks too, just standard mole examinations in patients at that age. I think because people are becoming more aware of their skin and what, wanting to make sure everything is normal and healthy, which is great. And then the skincare kind of obsession too, which is great. So a lot of them are starting to experiment with toners and products and moisturizers. And often at that age, they don't need a lot.
Yeah, right.
I would say a good sunscreen would be great. But I love talking to them about that stuff too. So I would say acne is the biggest thing. Another thing that they come in with concerns of would be like chicken skin. So bumps on their upper outer arms or sometimes their thighs we can talk about too.
Okay, great. So then that kind of takes us to our 25 to 55 age range. So a lot of, I would assume, like anti-aging or things like that. So do you see patients for that type of, discussion that patients might want to have?
Yeah, the anti-aging industry has really boomed in the last 20 years. And we're seeing younger and younger people getting into the anti-aging industry. So yes, that starts honestly in teenage years.
Okay.
But certainly there's an influx of that too happening in people in their 20s and 30s and beyond. At that age, it's a lot of skin checks. And what I mean by that is people are coming in and I'm looking at them from head to toe, making sure I'm not seeing any abnormalities on the skin that would worry me for a skin cancer or a mole that might be atypical that would need to be removed. So that's typically what I'm seeing people in that age range for. But we do a lot of cosmetic discussion too, or anti-aging discussions. And we talk a lot about, what techniques we can do to prevent aging. And then if there are early signs of aging, things that we can do to kind of treat those signs. So for anti-aging prevention, you're going to hear me say this all the time, Laura.
Yeah.
It's sun protection, sun protection. So if people aren't doing that regularly, but they're worried about aging, getting a sunburn or going out in the sun can really accelerate that aging process and can wrinkle the skin pretty quickly. So usually I'm implementing some good sun protective measures in those patients. And then for, if there are signs of aging that are already there, what I love about my clinic too is not only do I do medical dermatology and skin checks and kind of preventive screenings, but I can also do cosmetics. We have a lot of lasers at the Marshfield Clinic, which is great. We also do Botox. There's filler. We actually just got a micro needling pen. So all of these really amazing kind of anti-aging technologies available for our patients at the Marshfield Clinic.
So when you say a laser, microneedling, what is that?
Yeah, I know. So microneedling is a device that delivers kind of micropunctures to the skin, and it can help to kind of injure the collagen, which is in our skin, to plump it up. So it injures it to create some inflammation, but then the skin gets a little bit more plumper. So people with wrinkles around their mouth, I love microneedling. It's also helpful for people with acne scars, which I do see in patients who are in their 20s and 30s after they kind of got over a bout of acne in their teenage years. And then lasers, we use a lot of lasers for different things. So there are lasers that target different things within the skin. We have lasers that target red growths in the skin. So like people who have broken blood vessels on their face, we have a laser that can target that, which I love. I use it every day.
Wow.
We also have a laser that targets hair removal. So a laser hair removal machine.
Okay.
And then I have a laser, we kind of use that loosely. It's more of light technology, but it's called IPL or intense pulse light, which can target reds and browns in the skin. So kind of that, a lot of the aging concerns that people have is that their skin tone is uneven.
Sure.
And this laser can really help, laser light can really help target that.
Wow.
We also have a tattoo removal laser. I mean, we have a lot of awesome technology.
Wow. I didn't know all of that.
Yes.
That's fascinating. Excellent.
Yeah.
So then our final age group is kind of that like 55 and older. So I've never seen a dermatologist before. Why would I come now to see a dermatologist? What would be some of the things that you would see?
Yeah. So a lot of those patients are also coming in for skin cancer screening exams.
Okay.
So doing a good head to toe examination, starting in the scalp, going all the way down to their feet, looking at every square inch of their body to make sure I'm not finding a skin cancer. I think it would be important for at least everyone, especially where we're at, knowing we get a lot of boluses of sun in the summer months. I think everyone is probably deserving of at least one skin cancer screening examination.
Okay.
And certainly if you have a family history of melanoma.
Okay.
So those patients I definitely want them in my office. But a lot of the patients I'm seeing over the age of 55 are either my regular patients who've had a history of skin cancer, or they're coming in for a screening examination. And if you're prompting that yourself, like as a patient, what you want to be looking for would be a spot on the body that's painful, bleeding easily, meaning you barely touch it or you wipe your face with a towel and it bleeds.
Okay.
Or a growth that just seems like it's evolving. So it showed up one day and 2 months later it's doubled in size.
Okay.
Anything like that should really prompt you to come in and see a dermatologist.
Excellent. So I wouldn't necessarily need to be somebody that has a ton of moles to get a full body check. Like I should come in just on the safe side, talk through what's family history, that sort of thing, to really, because skin cancer, I think everybody's heard about. Everyone's heard about melanoma and what a terrible cancer that is, but there's a lot of other skin cancers. Can you tell us a little bit about things that you might see that are cancerous and what that kind of means, and the difference between melanoma and a non-melanoma?
Yeah. So I think you're right. Everyone thinks of skin cancer as being melanoma, which is a deadly form of skin cancer, and we take it very seriously in dermatology. Typically, that's a mole that's gone bad. Right. So it's like a brown spot on the body that looks funny. It might be bleeding. It's enlarged. But there are a lot of other types of skin cancers that we see, and they're way more common.
Okay.
And those are usually the sun-induced types of skin cancers. So people who've gotten a lot of sun during their life eventually develop enough damage cumulatively where they can make a skin cancer. And that would be basal cell carcinoma.
Okay.
It's actually the most common cancer in the world, and certainly the most common skin cancer. And then squamous cell carcinoma.
Okay.
They look, sometimes they can look very similar, and other times they look very different to the trained eye. But typically how they show up is it's going to be a spot that's in a sun-exposed area. So face, neck, upper back, arms, hands. We see a lot of these. And they show up as almost like a pimple. A lot of people describe them.
Okay.
That's bleeding and has a scab and it never heals. So they're like, I got a pimple 8 months ago.
Oh, wow.
And it hasn't healed. Well, that's a red flag to me. Usually that's a spot I'm probably going to be biopsying. They can often be painful. They can enlarge quite quickly. But one of the kind of nice things about these skin cancers is they're not necessarily as aggressive for the most part as a melanoma. So we usually treat them locally in the office, sometimes the same day.
Okay.
And then oftentimes we're biopsying and potentially referring for a surgery.
Okay. So important. That's excellent advice. I think, people think, this thing is bleeding, but it'll be okay. And it really could be something much more serious. So important to pay attention to those things. Well, this was fantastic information from like the, newborn to, to getting older. But we also know there's a lot of things, in our skin and hair and all of that, that's frankly embarrassing to talk about. People don't like to bring it up to their doctors. It's something that they hide a lot because it's just embarrassing. So I'm going to try to help our friends at home and ask a couple questions that might be a bit uncomfortable for people to ask their doctor that I'm hoping you can help with. And then if they're saying, yes, at home I have this, I need to go see a dermatologist. So hair loss in men and women, can a dermatologist help with that?
We love hair loss. I see hair loss every day.
Okay.
Yes.
Okay.
What you will see right now is a lot of hair loss commercials. And I'm excited that it's becoming kind of more widespread and less taboo to talk about hair loss, because it affects 50% of women by the age of 70. So it's a common issue, and we can certainly help with that. And again, thank you for talking about these embarrassing things, because sometimes I see patients are anxious to even ask me in a one-on-one setting. So I love that we're talking about it in a public venue. But hair loss, let's talk about that.
Yes.
So there are different types of hair loss, and dermatologists can do a good, thorough scalp examination and hair examination to determine where you fit. So although there are a lot of commercials out there that tout this supplement is kind of going to save your scalp and regrow all your hair, not all hair loss is that type of hair loss which is going to respond to a supplement.
Okay.
There are types of hair loss that actually need medication, sometimes even pill therapy, in order to get the hair to kind of grow back. And so I think dermatologists are really important in that venue to kind of do a good scalp examination and get you on the right track in terms of treatment.
So there is hope. If I've lost my hair, it can come back.
Yes.
That's awesome. That's wonderful.
Yeah.
How about the opposite end of that? Women, we get older, our hormones change, and hair starts growing where we didn't even know it could grow.
Yes. That is.
What do we do about that?
Yes. That is one of my favorite things to talk about with female patients, because it's one of those standards of beauty that none of us can meet, because we all have hair everywhere, including our face. Yeah. And so we do a lot of unwanted facial hair and unwanted body hair discussions in dermatology. What I love about the Marshfield Clinic is we have that laser hair removal laser, which is wonderful. I've personally gone through it. I've, had hair on my face that I had the laser on, and it's just been a game changer in terms of my own confidence speaking to patients and just doing my daily life. And so we have that. There are some topicals that you can use. There's other things that we can talk about too. And then that's another venue too, where if the hair loss is pretty extreme, we can actually get people started on pill therapy to help calm that down. Wonderful. So another example where a dermatologist can be really helpful.
Excellent. How about toenail fungus?
Oh, toenail fungus.
Is that your other favorite?
I don't know. Toenail fungus is a challenge. I see it on a lot of patients. I don't want to say every single patient, but it is so common. It's just fungus is ubiquitous in the environment. And so if you have a tiny little toenail injury and you're walking around a public pool, which we all want to do in the summer, you can pick it up. And so I see it on so many people. Now, the trouble with toenail fungus is that it's really challenging to treat and eradicate fully. And I quote this to patients often. We can do topical treatment that has a cure rate of about 30 to 40%.
Okay.
Oral treatment has a cure rate only of about 60%, maybe at best. So there's no perfect treatment for toenail fungus. But one of my favorite things to have people do at home is some home remedies. Which would be dilute vinegar soaks. Okay. So you're kind of adding some vinegar to a basin of water. Okay. Soaking your toenails in that or your feet. And it can really help to kind of chip away. It's a broad antimicrobial. It's pretty good against fungus. It can help a little bit to chip away at the fungus burden in the nail plate. And then Vicks Vapor Rub.
Oh, geez.
Which is
truly can be used for anything.
Exactly. It's like the Windex from my big fat Greek wedding. It is. We love it. I probably wouldn't put it everywhere, but toenails, yes. It's a great place for people to start. Yeah. And then certainly if they want to do more aggressive treatments for their toenails, we are here and available, and we do it all the time. So I think I talked about toenails this morning 3 or 4 times. Okay, wonderful. How about ingrown hair or razor bumps? Oh, razor bumps. Yeah, this is a challenge. Also something I've struggled with too. There are some things you can do. So first is good razor care. Okay. There are a lot of razors available to the public now. And, they say get the 5 blades. It's better for the pubic region. And the 4 blade is great for women. And it's like, what do I actually buy? Right. Well, we know that a lot of blades actually can introduce more ingrown hair. Okay. And so sometimes if people are really struggling with ingrown hairs, I have them buy the cheap single blade sort of like throwaway razors that they could use. So that's an option, just to make sure you're using the right razor. And then toss your razors regularly. So don't use the same razor for months and months on end. You want to make sure that you're changing that razor head quite frequently. I usually tell patients like every 2 to 3 weeks. So it's more frequent than you think. Okay. Is that because it's got bacteria in it? Okay. It's not because the razor's dull and it's causing... Nope. So usually the razors are... The technology is so advanced now that the blades themselves probably stay sharp for a longer period of time than that. It's just you're getting dead skin cells on it. There's bacteria. So unless you're sanitizing and sterilizing your razor, which I would be I'd be very impressed if people are.
Yes. Yeah.
You would want to make sure you're changing it out frequently.
Okay.
And then I like to use antimicrobial washes as a pre-wash for shaving. So if you're prone to razor burn, let's say in your armpits, use an antibacterial or acne wash in your armpits, something like a benzoyl peroxide.
Okay.
So maybe a day or two before you shave, the day of shaving, and then the day after. It can really cut down on the burden of razor burn. Excellent. And then looking for like a sensitive skin shaving cream.
Okay. Wonderful. How about like rashes and skin folds? I think that's something that people deal with a lot and they don't really like to talk about. How do they handle that?
Yeah, that's another very common problem that I talk to patients about every single day. See a lot of it in the summer because it gets really hot. So what happens in that scenario, it's an entity we call intertrigo. It's a friction issue and it's a moisture issue. So it happens in between skin folds where there's friction. But you want to make sure to prevent it. You keep the area dry. So I usually counsel people on keeping that area bone dry. Sometimes that means using a blow dryer, like a hair blow dryer on the cool setting to blow the areas dry and then apply ointments. And so if it's rashy, people can actually buy over-the-counter products. Okay. Clotrimazole cream, which is an antifungal cream. You'll see it for athlete's foot. It's fine to use in your folds. Sure. Don't worry about that. And hydrocortisone. Yep. So that's 1% over the counter. You mix the two together and you put it in any area that's inflamed in the folds. Very safe to do for short periods of time, usually 2 to 4 weeks to clear it up. And once it's clear, you actually want to help prevent it by keeping it dry, but also considering a barrier ointment like Vaseline, Aquaphor, or Desitin. You put a thin layer of that down in the area you're prone to rashing. And what that does is it lubricates that skin, so there's less friction. And if you sweat, it'll bead on top of the ointment and stick there instead of on your skin, which will cause irritation. So those are, I have a lot of patients that just do the over-the-counter treatments and they have great success with that.
Wonderful. That's wonderful. How about, you kind of talked a little bit about it, but I know I hear quite a few people talk about like bumps on their arms or the chicken arms.
Yes.
How do we treat that?
Yes, so chicken skin.
Yes.
The medical term for that is keratosis pilaris, and it's very common. First, I always tell patients it's not a disease like eczema. Yeah. It's not something that we can cure. It's actually your skin's type. And it's usually passed down from family. So if you had a parent who has it, you're more likely to get it, and so on and so forth. But the way I like to treat that is with a good emollient. So first and foremost, you have to put on a moisturizer every day. And then if you want to be really aggressive and try to get those bumps to smooth out, you want to use an emollient or moisturizer that has an acid in it. There are a lot of them available over the counter. I personally like ones that have salicylic acid in it. So CeraVe SA, Cetaphil makes a great one. So does Eucerin. But there's other brands like Amlactin. Oh, sure. There's urea cream. So those are all wonderful. The key, though, with the chicken skin or keratosis pilaris is you don't want to exfoliate.
And I think that's what a lot of people try to do.
Yes, a lot of people buy scrubs with the beads in it, and they try to exfoliate that out. And what that does is it actually causes more inflammation. And it makes it worse. And so we want to really stop that. Don't use a loofah over the area either. You really want to kind of focus on it being an area of sensitive skin. So kind of gentle skincare. Good dry skin cares, good emollient use, and then if you're really wanting to be aggressive with it, using an acid-based moisturizer.
Excellent. All right, how about my last one? Stinky feet. I don't know who doesn't have stinky feet, but I think there's people out there that have really stinky feet. So what are we doing with those people?
Yeah, so for those people, a lot of the problem is actually socks. And staying in your occlusive shoes for way too long. So we want people to air their feet out. So as soon as you're done with your job for the day, go home, take your socks off, take your shoes off, and walk around barefoot. It kind of gets that moisture problem. You'll see the theme here. There's too much moisture is not good for the skin. So kind of get that moisture problem gone. And then using an antimicrobial wash, just like you would for the razor bumps, on the bottoms of the feet can be very helpful. Helps to decrease the bacterial burden that live there, that when your feet are sweaty, it's like, ooh, I like the taste of this skin. I'm going to eat it up. And that's what creates the odor. Certainly, it can get to a point where you might need more topical antibacterial products that require a prescription, and that's what we're here for. But at least getting started with some good antibacterial washes at home can be very helpful. And getting out of the socks.
Absolutely. All right, now we're going to have a little fun, as if that wasn't enough fun for us all. But I'm going to give you a couple words, and you're going to rate them 0, like throw it away, don't try it, or 10, when we're done here, I'm going to the store. And because I know there's a lot of stuff out there, as you said, but some of it we know works great, some probably not so much. So we're going to help our friends at home with some of this stuff. Like this. All right. Retinol for anti-aging.
10.
10.
Retinol is a 10. Do not sleep on a retinol.
Okay.
Meaning that is something you should go out and buy right away if you're not on it. Anyone over the age of 20 deserves to be on a retinol. What that is it's a vitamin A derivative. Now, if you're pregnant, talk to your doctor.
Okay.
But everyone else, it's a vitamin A derivative that increases cell turnover.
Okay.
So it can kind of help even out skin tone. It helps to plump our skin a little bit. It can help smooth out some fine lines and wrinkles. So certainly 10 out of 10.
Excellent. How about minoxidil for hair loss?
Yeah, minoxidil. Also a 10 out of 10.
Okay, wonderful.
So even in all the different types of hair loss that I see, some that are inflammatory that need medicines, and the standard type of hormonal hair loss, I'm using minoxidil.
Okay.
And there are different types. There's topical minoxidil, which is really easy to get over the counter. And then there's prescription pill form of it, but definitely 10.
Okay. What about like hair or nail supplements?
Ooh, great. I would say 5 out of 10.
Okay.
I like those a lot for nails. I do think that they're very helpful for nail health, but a lot of people are taking them for their hair.
Yeah.
And it's probably not enough to get you that voluminous hair back that you were hoping for.
Okay.
You'd be better to get that 10 product, which is minoxidil.
Excellent. What about anti-dandruff shampoo?
Also a 10.
Okay.
Yeah, I love that.
So it really does work.
Yes, for dry, itchy scalps, 10. And you can get that over the counter easily.
Essential oils. That's a big one for the young kid.
Oh.
What are you going to break our hearts, aren't you?
I know, probably a 2.
Okay.
I think that they smell good, in a diffuser, having it in the ambient air, but on your skin can be a little caustic and cause contact dermatitis. So a 2 would be my rating.
Acne patches.
Love acne patches. 10. Acne patches are wonderful. I still deal with acne, and I use acne patches all the time. They draw the whitehead into the patch, so you're not kind of sitting there manipulating the zit. 10. Great.
Wonderful. Product. Neosporin. Everyone's got Neosporin at home. Are we using it?
Yes, they are, and they are using it. I would say probably, again, about a 3 out of 10.
Okay.
If you have true infection in the skin, maybe I would say Neosporin's a good product, but it causes a lot of allergy, and so not my favorite product to use.
Good to know. So it's just soap and water?
Soap and water, and then a lot of times wounds aren't infected, so just Vaseline would be fine.
Okay. Hydrogen peroxide.
Hydrogen peroxide would be a 4 out of 10.
Okay.
Again, people overuse it. It can be really drying to the skin, and so I would prefer just plain Vaseline, and if a wound is dirty, have us evaluate it.
All right, and my last one, at-home wart treatments.
I would say most of them can be an 8 out of 10.
Okay.
So 8. I don't like the cold spray wart treatments. I don't think they're very effective, but salicylic acid wart treatments are great.
Wonderful. Well, I always like to end my show with a little fun question. I did that with Dr. Horniman last month. So you named off 3 really phenomenal colleges you went to, and I also know you're a sports fan. So it's the Final Four men's basketball. We got UW-Madison, Duke, Stanford, and we got to throw North Carolina in there just because. Who's in the finals, and then who's going to win in your world?
UW-Madison. The Badgers are taking us this year. It's going to be UW and Duke, and we're taking it this time.
Excellent, excellent. That is wonderful. That is wonderful. Well, Dr. Moses, I cannot thank you enough for coming here today.
Thanks
this was such a joy talking to you. I learned so much, so I'm certain our friends at home learned a lot as well. If you or someone you know would like to see Dr. Moses or one of our other amazing dermatologists, please call our clinic at 387-5311, and we would be more than happy to set up an appointment for you. Please join me next month as I welcome Dr. Meese, our Chief Research Officer. She's going to come and talk with us about farm medicine, all of the wonderful research that's going on, including a very intense tick study that they're doing right now. So you are not going to want to miss that. So thank you so much. And until I see you next month, be well, my friends.